Yes.
So everybody has studied so far whatever we have covered yesterday? No? Yes sir, no? Yes sir. Okay. There is an angle called renal angle. Do you know what is renal angle? What's the use of it? So the renal angle is the angle between the 12th rib and the lateral border of erectile spinae. Erectile spinae is a back muscle which go all the way from below upwards in this manner. Okay, we are erecting, we are standing in this manner because the muscles on the back is pulling backwards in this manner. Okay, so those muscles are the erectile spinae which are vertically situated on the back. Okay, or behind the psoas major and quadratus lumborum, this muscle is situated on the back side. Okay, all the way from the spines and of course from the sacrum, posterior surface of the sacrum, the erectile spinae will go above. Okay, so this erectile spinae, the lateral border of the erectile spinae, without of the lower border of the 12th rib is the angle over here, which is called the renal angle. So what's the use of this angle? You can see that the posterior surface of the kidney over the lower aspect, this part of the kidney is related to the renal angle over here. Okay, this can be used as an identification of the pain from the kidney by means of an action called what is it? Exactly, tenderness will be elicited at the level of renal angle. How I will show you later. Okay, and then if any surgeon is going to operate on the kidney, that surgeon will be making incision over here in this manner on the posterior aspect, and he can reach the kidney from the posterior aspect over here. Getting it over? So the renal angle, whenever a patient is complaining of pain in the loin over here, this part is called the loin over here. Okay, this part is called the loin. Okay, and this part is called the flank, and this part is called the groin. Okay, what is it? Loin, flank, and groin over here. Okay. So if a patient is complaining of pain in the loin over here, okay, that is radiating towards the front of the abdomen over here. So you may think of the pathology is from the ureter or from the kidney over here. Get it over? Either from the kidney or from the ureter over here. So to identify the pathology which is or problem within the kidney on the posterior aspect, whenever you count the ribs all the way from above downwards. So the lower angle or inferior angle of the scapula corresponds with which rib? The inferior angle of the scapula corresponds with which rib? Seventh rib. So from that onwards you will be counting the ribs downwards and you will be reaching the 12th rib over here, and a little bit of lateral, towards the lateral end of the 12th rib, just below the 12th rib will be the renal angle. Okay. So on the posterior aspect, wherever the loin is present over backside over here, you will be keeping a hand over here, and if you tap over in this manner over the back, so if a patient complains of increased pain, that is nothing but the tenderness over here, then you can assume that there is a problem in the kidney over here. So if he is not complaining of pain or tenderness over here, the pathology probably within the ureter over here. Got it down, right? Right. So that is the use of this renal angle. One is for the surgical approach, and one is to identify the renal abnormality in case of colic pain of the kidney or ureter. Okay. So this is nothing but the renal angle. So how the kidneys can be injured? Clinically, how the kidneys can be injured? So this part is termed as hilum, and this part is sinus. Sinus is a closed cavity or open cavity? Closed cavity, exactly. Okay. So if a patient patient met with a road traffic accident, for example, from the back. Okay. So for the right kidney, there will be the 12th rib will be in contact with the right kidney, and 11th and 12th ribs towards the left kidney on the posterior aspect. Okay. So whenever hit from back, the ribs will be fractured, and the fractured ribs will be penetrating the kidney over here. Is it alright? Right? So if there is a little penetration, little bit of blood will be beneath the capsule and within the substance of the kidney over here. For example, over here, 12th rib over here. So that 12th rib, little bit impacted into the substance of the kidney. So little amount of blood has been leaked in between the capsule of the kidney and substance of the kidney. This is called contusion of the kidney. What is it? Contusion of the kidney. Okay. So for example, if it is further, if the injury is further encroach deep into the kidney over here, this is called laceration. What is it? Laceration. Okay, laceration is deeper cut. Okay. So how you will identify the bleeding which is occurring from the kidney over here. Okay. So if it is occurring towards the outer aspect, all the way away from the pelvis of the ureter over here, so the blood will be leaking into the peritoneal cavity. The blood will be leaking into the peritoneal cavity or not? Where it will be leaking? Retroperitoneally, the blood will be leaking over here. Getting it over? So the patient will be getting palpitations. Okay, whenever the bleeding occurs through the kidneys over here, because lot of blood will be passing through the kidney and the urine output will be occurring over here. So whenever there is any internal bleeding, the patient will be developing palpitation because of the excessive heart rate over here. Okay, so that is an indirect evidence over here. What is the direct evidence? For example, if this blood, because it is very much close to the renal pyramids over here. For example, there are renal pyramids over here. So if the blood enters into the renal pyramids over here, that blood will be carried towards the papilla of the pyramid, and that will be evacuated into the renal calyces over here, further into the renal pelvis, and further into the ureters, and further into the bladder over here, and further outwards towards the urethra. So the urine, whatever it is carried over here, will be carrying the blood over here, which is a direct evidence of renal injury over here. Right or not? So this is the indirect evidence over here, the internal bleeding over here, and then followed by, the other aspect of evidence is, direct evidence is, the bleeding through the ureter and urinary bladder and through the urethra over here, towards the urine output over here. Within the urine, there is any color change like reddish brown in color. That indicates there is a bleeding from the kidney over here, followed by road traffic accident. Okay. For example, there is no accident occurred over here, but the patient has been having fever, chills, fever and chills, and pain in the lower abdomen, and pain while passing urine also. What is it? Pain while passing urine. Okay. So what is the condition? Fever with chills, that means shivering sort of, and then followed by pain while passing urine and pain in the lower abdomen. Okay, what do you think of? The fever indicates any bacterial or viral or parasitic, whatever it might be, there is an infection. Okay, and then chills automatically, whenever the fever occurs, chills automatically occurs, and then followed pain while passing urine. Obstruction while passing urine. While passing urine is an obstruction. Infection. Okay. What is infection means? So virus or bacteria or whatever it might be, whenever it is entering into the body, that process is termed as infection. Whenever a foreign organism entering into the body, that is called infection. Yeah, you know. Whenever the infection occurs, there will be inflammation. What's the difference? Okay, ulcer, it's a different thing. Ulcer is a discontinuity of the surface epithelium. That is called the ulcer. Okay, that's a different thing. What? No. What? Yeah, that's what we're discussing. Infection only, obviously, what is happening over here. For example, pain while passing urine. Exactly, that is the thing. Inflammation occurs. Whenever the infection occurs over here, inflammation will automatically occur because the body will be fighting with the pathogens over here, the bacteria or virus, whatever it might be. Okay. So if the bacteria has lodged within the penile urethra over here, okay, or in the female urethra also, okay, beyond the urinary bladder to the urethra. If the infection has occurred within the urethra over here, there will be inflammation occurs within the urethra. So whenever the urine has been passed through the urethra, this area is already inflamed. Whenever you are passing the urine, that will be further irritates that particular inflamed area. That is leading to pain while passing urine over here. Getting it all right? So this infection may ascend into the urinary bladder, and through the ureters it may ascend into the kidney over here. So whenever it is reaching the kidney over here, it will be infecting the kidney. Is it alright? Whenever it is infecting the kidney, inflammation will occur again over here. So whenever there is a breakage of the blood vessels over here, blood will be leaked into the pyramids over here again. So again, the urine will be having the blood over here. Getting it alright? Two situations over here. One is road traffic accident, direct injury to the kidney, direct injury to the blood vessels. That will be leaking through the urine over here. Okay. And one more indirect thing is nothing but through the infection. Whenever infection occurs through the urethra, so if there is any unhygienic condition, that means if a patient doesn't maintain the hygiene around the genital region, that will get infected. Urethra will get infected, and then followed by that infection will be ascending backwards into the urinary bladder, into the ureters, into the pelvis of the ureter, and finally into the substance of the kidney over here. So kidney will be having multiple blood vessels over here. So if because of the pressure, because of the pus formation, because of the pressure, if the blood vessels bursts out, that leak will be entering into the, that means the blood will be entering into the urine over here. Okay. This blood in the urine is termed as exactly hematuria. Okay. So two different scenarios, one with the fever, chills and pain while passing the urine, and lower abdominal pain over here. Okay. And the other is road traffic accident over here. Right or not? So whenever the urine is having the blood, or whenever urine turns reddish brown in color, that indicates some pathology within the kidney over here. Or it might be in the ureter also. We'll be discussing that later. Got it? Yeah, that's what. Okay. Yeah, that's what I was about to tell. Okay. See here, in case of males and in case of females, the relationship between the external environment and the peritoneal cavity we will discuss now. Okay. First of all, in case of females, the peritoneal cavity is termed as open type, and in case of males, it is closed type. Okay, why it is so? So whenever the thing is related to the infection over here. Infection means from the external environment. However, how the infection is communicating with the peritoneal cavity over here. How the external environment is communicating with the peritoneal cavity over here. Okay. In case of males, the infection from the outer aspect, that means nothing but the external environment, it is reaching till the kidneys only. There is no communication between kidneys and the peritoneal cavity over here, because kidney is a retroperitoneal structure. Is it not? Nowhere it is in contact with the peritoneum over here. Peritoneal cavity over here. It is behind the peritoneum. Getting it over? So whatever the infection occurs over here, it will be entering till the kidneys over here. Even if there is a pus formation over here, that will be leaked into the retroperitoneal aspect, not into the peritoneal cavity over here. Getting it over? Getting it over, right? So that's why the infection from the external environment will not be communicating with the peritoneal cavity in case of males. What about females? Females, what is happening to the females? Yeah, I'll tell you. Yeah. Piece of ovarian, exactly. See here now we're focusing on the female genital system over here. Okay. So these ovaries are in contact with the peritoneal cavity. Okay. Let us see that. First of all, these ovaries are situated within the peritoneal cavity. Getting it over? But the uterine tubes are situated below the peritoneal cavity or within the folds of the peritoneum over here. Okay, we'll be discussing that during female genital system. Okay, but for now, what you're supposed to remember is ovaries are situated within the peritoneal cavity, but uterine tubes are outside the peritoneal cavity over here. Okay. So, whatever if the infection occurs all the way from the urethra and then followed by the vagina over here and then cervix and uterus and further enters into the fallopian tube or uterine tube and reaches the fimbria over here in case of females. Okay. There is a point of contact between the ovaries and the peritoneum over here in the name of meso-ovarium. Okay, meso-ovarium is a point of contact, nothing but the peritoneal fold which occurs in between the fimbria and the ovary over here. You know the fimbria very well, is it not? Right? So the fimbria, finger-like projections of the uterine tube that will suck the secondary oocyte all the way from ovary into the uterine tube over here, right? So these are the fimbria. This fimbria comes in contact with the ovary through a fold of peritoneum called the meso-ovarium. Getting it over? So whenever the infection enters till the fimbria, it will be further entering into this meso-ovarium, and that meso-ovarium is nothing but the parietal peritoneum. So this infection can easily enter into the peritoneal cavity over here. Got it or not? So in case of males, the infection will stop over here, and that too situated retroperitoneally, so there is no chance of entering into the peritoneal cavity. So that's why in case of males, it is closed type of peritoneal cavity over here. In case of females, because there is a meso-ovarium with the openings of the fimbria over here, the infection straight away enters till the fimbria, and from the fimbria it enters into the meso-ovarium, nothing but the peritoneal fold over here. So the infection through this meso-ovarium enters into the peritoneal cavity over here. Understood or not, everybody? Right? So in case of females, it is open type of peritoneal cavity. So if there is any urinary tract infection over here, females can easily get the infection into the peritoneal cavity over here, because this is the urethra and vagina, very much close contact with the urinary tract infection over here. Got it or not? Right? Got it or not? Right? Understood? Right? So which one is longer and thinner? Which kidney is longer and thinner? Left. It will be reaching till the not 11th rib. It's not about of course vertebral level, but it will be reaching till the 11th rib level. You have to say ribs. Okay. So for example, so left vein is longer than the right vein because vena cava is situated towards the right side. Is not right? So, for example, if there is a malignancy of the kidney, left kidney, if there is a malignancy of the left kidney, so that malignancy will be spreading to other regions through the renal vein. Is it not? So the cells will be passing through the renal vein and will be distributed to the other areas of the body. Right? There is a malignancy in the kidney that will be spread to the other areas through the renal vein, because renal vein will be carrying the blood away from the kidney. Is it not? So whenever it is going over here, because this renal vein will be draining one more vein over here. That is vein is nothing but gonadal vein over here. So whenever these cells are passing, few cells will be accumulating at this opening of the gonadal vein over here. So if there is any obstruction of this gonadal vein because of the accumulation of the cells over here, that leads to obstruction of this gonadal vein. If the gonadal vein is obstructed, what will happen? A condition called varicocele. Exactly. Varicocele. Varicocele means, I have already told you what is varicocele. What is varicocele? What is varicose vein? Forgot, huh? What's that? What's that? It's okay, what are it? Okay, fine. So because there is a obstruction of the gonadal vein over here, so the pressure, the blood pressure, whatever it is, with what pressure the blood is going into the renal vein will be backed up. Is it not? Just like the portal hypertension portal vein, what are the pressure with which the blood is passing upwards over here, that should be backed up. So what will happen? There will be pooling of the blood within the veins over here, which are called the pampiniform plexus of veins. We will be learning it later. Okay. Or simply say that there are plexus of veins around the testis over here, which are called the pampiniform plexus of veins. Those will be having a pooled blood over here. So the blood vessels over here will be dilated. So what will happen if the blood vessels and the blood vessels are dilated over here and pooling of the blood occurs over here? That will be leading to, what is it? Testis will be kept away from the body. What for? Yeah, the body little bit less compared to the body temperature should be for the testis. Otherwise, the patient will land up in infertility. Getting it? So that's why the testes are situated outside the body within the scrotal sacs over here. Okay. So whenever there is increased temperature because of this, the patient will be landing up in infertility over here. So obstruction of the gonadal vein leads to pooling of the blood in the plexus of veins, which are called the pampiniform plexus of veins, around the testis over here. That indirectly leads to infertility in case of males. Is it not? In case of females or not? In case of females or not? Testes are there in males or females, yeah? Obviously, okay. Nothing will happen because there are no testes over here. Okay, right. Gonadal veins will be draining the ovaries over here. There are no such pampiniform plexus of veins in case of females. So there is no chance of infertility over here. And moreover, ovaries are situated within the body. Is it not? The ovaries are situated within the body, not outside the body, just like the males over here. So there is no chance of temperature variation in case of females. Okay, right. So what is varicose vein means? If these veins are dilated over here, these veins are dilated, that thing is nothing but the varicose vein. Varico means, what is it? Varices means what? Dilated blood vessels are called the varices. Is it not? Varicose veins you would have heard, right? So varices means dilated veins over here. Okay. C means like a sac sort of. Okay. So the thing is, if there is a scrotum over here, these pampiniform plexus dilated veins are situated within the sac of scrotum. Okay. Like in surgical aspects, it is termed as bag of worms. This is the bag, scrotum is a bag, and worms over here. The multiple veins acts like the worms over here. Okay. So this bag of worms is termed as varicose vein. C means like a sac. Varices means dilated vessels over here, nothing but the veins over here. Okay. So in this manner, because of the malignancy of the kidney, there will be varicocele occurs in case of males over here. Understood or not? And one more chance of occurrence of varicocele in case of males by means of, any idea? So, for example, there is a pancreas extending over here horizontally. Is it or not? In front of what is it? Pancreatic tumor. Okay. We'll see that. Okay. So there is a pancreas extending from the hilum of the right kidney towards the hilum of the left kidney. Is it not right? You know the relations of the kidneys are not right? Anterior aspects, right? So obviously in front of the renal vessels over here is the pancreas over here. So above the pancreas there is a vessel which will be emerging out from the ventral aspect of the aorta. What is that? Sorry. Celiac trunk. Absolutely. That's right. Right. Celiac trunk, and behind the pancreas is the superior mesenteric artery over here. How the superior mesenteric artery emerges out in front of the, of course, third part of the duodenum, and one more ulcerate process in front of the ulcerate process. So the superior mesenteric artery will be emerging out in this manner. Is it not? The superior mesenteric artery will be emerging out in this manner. So if you see properly, there is a chance of obstruction in certain individuals by means of superior mesenteric artery to the renal vein over here. Could you ever see that? Whenever the superior mesenteric artery is passing over here, there is a chance of obstruction of the left renal vein over here. So indirectly it is obstructing the gonadal vein again over here. That is again leading to the varicocele over here. So two occurrences of varicocele over here. One is because of the obstruction by means of superior mesenteric artery in certain individuals. Okay, certain individuals. For example, there is an increased abdominal pressure, for example, certain individuals. That leads to compression over the superior mesenteric artery. That will be occluding the left renal vein. That indirectly occludes the gonadal vein. That will be forming the varicocele over here. One because of the malignancy and one because of this obstruction by means of superior mesenteric artery. Got it down, right? So this condition will be asked as a short notes. Varicocele, what might be the conditions? Okay, how it might land up there. Okay, right? Anybody? Yesterday I have asked you a question. How the toxins? Urothelium. Okay, fine. Not exactly. What is it? Uroplakin. That's the answer. That's it. So uroplakin. Okay, I'll tell you. Everybody understands over here.
Servicing देखने बोलती
So you know the different layers of epithelium in our body.
इधर resurfacing ऐसे बोलते
One or two nuclei will be present, one or two nuclei will be present. These are the rest of the layers of cells. Okay, and this is the lumen of the ureter, and this is the superficial most layer among the stratified epithelium. Is it a stratified epithelium or not? Urothelium is a stratified epithelium or not? It's a stratified epithelium, but not squamous epithelium. It's transitional epithelium. Okay. So this is the luminal surface of the outermost cells, superficial most cells, which are called the umbrella cells, right? So this is lined by continuously by means of a glycoprotein in this manner, only towards the luminal surface, not towards the alluminal surface over here, not towards the other surface. Okay. This luminal surface will be lined by glycoprotein over the surface of these individual cells. Okay. It will be covering the entire lumen throughout the ureter over here. So this glycoprotein, which is called the uroplakin, will be preventing the entry of toxins all the way from urine over here into the surrounding tissues. This is an important wise question. Got it or not? This will be asked for the external examiners generally. Okay. So the toxins from the urine will not be entering into the surrounding interstitial cells over here because of presence of the glycoprotein over here. Nothing but the uroplakin over here, which is situated over the surface of the cells towards the lumen over here. Understood or not, everybody? Right? So the transitional epithelium will be present in which areas? What's that? Ureter, that's all. Ureter and then minor and major calyces also. Everywhere there will be dilatation of the calyces, major calyces and minor calyces and ureter and urinary bladder. So everywhere stretching will occur. So obviously the urothelium, nothing but the transitional epithelium will be present. Not only in the urinary bladder, not only in the urethra, but also in the pelvis, but also in the major calyces, but also in the minor calyces. Simply from minor calyces in the urinary bladder, a little bit of beginning point of the urethra is also lined by the transitional epithelium. Got it or not? Where the stretching occurs, there the urothelium will be present. Okay. So the nerves of yesterday, details about the renal circulation, arterial supply, venous drainage will be dealt in the lecture class. Okay. Done now. Right. So you know. So what about the nerve supply of the kidneys? What is the nerve supply of the kidneys? What is the nerve supply of the kidneys? One is the sympathetic nervous system and one is parasympathetic nervous system. What is the use of sympathetic nervous system? What? Okay. Any other? Main, not sensory, motor activity. Okay, motor activity. What it does to the kidney? What happens in the kidney with the help of the sympathetic nervous system? Sympathetic nervous system will not do much, but it will be leading to vasoconstriction. Is it or not? Sympathetic nervous system will be doing the vasoconstriction in case of kidneys over here. Got it or not? And parasympathetic nervous system, got it? Of course, vasodilatation. So parasympathetic nervous system, obviously for the vasodilatation, that's all. No other activity in case of kidneys by means of sympathetic and parasympathetic nervous system. Mainly it is concerned with the blood vascular constriction and dilatation. Got it or not? There are no any smooth muscles in the kidney to contract. Got it or not? Right? So this is about the nerve supply of the kidneys and venous drainage and the artery supply, you know very well. And let us see the ureters today. So let us discuss the ureters, how the ureter is formed. All the minor calyces will be joining together and form the major calyces. All the major calyces will be joining together and form pelvis of the ureter. Pelvis of the ureter is also termed as a renal pelvis, which is nothing but the dilated uppermost portion of the ureter. Okay, dilated portion of the ureter, which is on the uppermost aspect, that is called the what is it? Renal pelvis or pelvis of the ureter. Okay, what are the terms might be? Okay. So this dilated portion will become narrowed slowly and becomes a ureter actually. Okay. So this ureter, this pelvis, whenever it is reaching the lower end of the kidney, that will be turning into the ureter. This point is very much important. Try to understand this. The pelvis is the renal pelvis is the uppermost dilated portion of the ureter, which is formed by the coalescement of all the major calyces over here. So this dilated portion is called the pelvis till the lower end of the kidney or lower pole of the kidney. From then onwards, it is termed as the ureter over here. Getting it out? So, and the ureter, this is a ureter from below this lower end or lower pole of the kidney, contains these two parts over here. What are those? One is the abdominal part of the ureter and one is the pelvic part of the ureter. By this you can understand. This part is in the abdomen and this part is in the pelvic cavity over here. Right? This pelvic part of the ureter is again divided into vertical part, oblique part and intravesical part. What is it? If you take the pelvic part of the ureter, there will be vertical part and there will be oblique part and there will be intravesical part over here. Got it or not? And above this is the abdominal part of the ureter. Got it or not? How it is directed? So if you imagine there is an L shape of the ureter on either sides over here. So that is the direction of the abdominal part and then followed by the pelvic part. Got it or not? So do you think that ureters are intraperitoneal or extraperitoneal? The ureters are extraperitoneal, outside the peritoneal cavity, and they are retroperitoneal or not? Yes. Obviously it is retroperitoneal. Okay. The abdominal part of the ureters are retroperitoneal, but the pelvic part of the ureter are subperitoneal. Subperitoneal. Is it not? Retroperitoneal, nothing but the abdominal part of the ureter. Subperitoneal, below the peritoneal layer, is nothing but the pelvic part of the ureter over here. Got it? So, Let us see the relations of the abdominal part of the ureter. You yourself can see. So on the posterior aspect, which structures will be coming in contact with the ureter? Just think that here will be the T12, L1, L2, L3, L4 and L5. So on either sides of these lumbar vertebra, which structure will be present? Psoas major, absolutely. So here will be the psoas major and here lies the quadratus lumbar. So psoas major is the posterior relation of the abdominal part of the ureter. We are not discussing only the abdominal part of the ureter, not pelvic part. Okay, only the abdominal part of the ureter. Till the pelvic brim we are discussing it. Okay. Okay. So all the way from the lower pole of the kidney till the pelvic brim you know that very well. Pelvic inlet, right? So till that part is the abdominal part of the ureter. So first one, the posterior relation is the psoas major. So if there is psoas major in front of the psoas major, which nerve will be present? Genitofemoral nerve. So these two are the relations, posterior relations of the abdominal part of the ureter. Abdominal part of the ureter extends between lower pole of the kidney till the pelvic brim. Okay, pelvic brim. Okay. So those are the posterior relations. No other thing is present. Is it not? Psoas major and genitofemoral nerve. Any other structure is present? No, right? Then. So the medial relation will be the inferior vena cava for the right ureter and aorta for the left ureter. Medial relation. Coming to the anterior relations, what structures can pass in front of the ureter? Think about the branches and tributaries of the inferior vena cava and the aorta. So if you imagine the pancreas over here, okay. So around this pancreas there will be duodenum over here. So over here there will be which part of the duodenum over here? Third part of the duodenum. So third part of the duodenum will be coming in contact with the anterior aspect of the ureter over here. So further downwards, if there is an uncinate process over here, which structure will be passing in front of it? Exactly, superior mesenteric artery and superior mesenteric vein will be passing in front of the ureter again. Got it already? Okay. So this is the superior mesenteric artery and superior mesenteric vein which are arising all the way from the behind the pancreas. Okay. So, and then what else? The superior mesenteric artery will be giving rise to branches or not? Which branches it will give? Which branches it will give? Colic branches, right colic branch and ileocolic branches will be in relation with the ureter over here, because ureter will be all the way going towards the pelvic brim over here. Is it or not? Could you understand? So ureter will be going in the pelvic brim in this manner. So there will be right colic artery, which is because the colon will be related in this manner and ascending colon will be over here. So the right colic artery and its branches will be the anterior relations of the ureter over here. Could you understand or not? Right? Not only the superior mesenteric artery branches, not in the middle colic artery over here. Sorry, not only the right colic artery over here, but also the ileocolic artery also will be the relations of the anterior aspect of the ureter over here. Could you able to remember or not? So whenever we have lifted up the mesentery along with the small intestine, we have seen the ureters. Is it or not? Whenever we have lifted up the mesentery and the small intestines, we could able to see the ureters on either sides. Is it or not? Could you able to remember from the dissection, right? So all these vessels and even just below the renal vessels there will be one more gonadal vessel. So gonadal vein and gonadal artery is also a relation with the anterior aspect of the abdominal part of the ureter. Got it already? So let us look at from all the way from above downwards. First of all there will be third part of the duodenum and then further by means of superior mesenteric artery and superior mesenteric vein. Further downwards will be the branches and tributaries of the superior mesenteric artery and superior mesenteric vein, nothing but right colic and ileocolic arteries and its veins over here. And further downwards if you go, this is the gonadal vein and gonadal artery as simple as that. Is it not? Right? So these are the relations for the abdominal part of the ureter over here. Okay. Let us see the pelvic part of the ureter. So here you are supposed to understand very clearly Let us see the pelvic part of the ureter over here. So the pelvic part will there be any other relation over here? The intestines, obviously the jejunum and ileum will be in relation with the anterior aspect of the ureters. Okay, those are the intestine or GIT part. So far we have seen the vasculature part, and further in front will be the intestines over here, jejunum and ileum will be in relation with the anterior aspect of the abdominal part of the ureter. Okay. And then now we are entering into the pelvic part of the ureter, which you are supposed to remember. Okay, abdominal part is very much easy, you know the relations and everything. So, by the side of the vertebra and in front of the abdomen, it will be entering into. This is the abdominal part of the ureter. Now it is becoming the pelvic part of the ureter. Pelvic part of the ureter is very much important. Okay. Pelvic part of the ureter will be entering at the level of the sacroiliac joint over here. What is it? Sacroiliac joint. Okay. At the level of the sacroiliac joint, we have, what is it? What is it? Triangulum marsally from deeper to superficial direction. What structures we have at the level of the sacroiliac joint? Okay. Here about the sympathetic trunk towards the medial aspect, towards this part exactly. What is it? Yeah, so okay, but I asked over here. What is it? Obturator nerve and then any what's it? Iliolumbar artery. So those are the deeper aspects over here. What is it? Lumbosacral trunk, even further forwards. Sympathetic on the medial aspect. Any other? Okay. There will be bifurcation of the common iliac artery into external and internal iliac arteries. Is it not? Obviously, the ureter will be passing in front of the bifurcation of the common iliac artery into external and internal iliac arteries. Could you remember or not? Right? So the aorta will be going over here and divides into common iliac arteries to common iliac arteries. Those common iliac arteries will be dividing into external and internal iliac arteries over here. So at the bifurcation of the common iliac artery into external and internal iliac arteries, this ureter will lie in front. Getting it or not? Right? Right or not? Right? So from there, the ureter will be passing over the lateral wall of the pelvis. Okay. So towards the lateral wall of the pelvis, which is formed by the pelvic surface of the iliac bone. Could you remember? Pelvic surface of the ilium. This is the sacral surface, and here will be the pelvic surface of the ilium over here. Okay. So over that region, that means over the greater sciatic notch or parallel to the greater sciatic notch over the pelvic surface of the ilium, the ureter will go further downwards over here. Okay. This part is the vertical part of the pelvic part of the ureter. Getting it out? And whenever it reaches the ischial spine over here, for example, this is ischial tuberosity and this is the ischial spine over here, it will take an oblique turn in this manner. Oblique turn in this manner over here. Getting it out? So this is an oblique part or second part of the pelvic part of the ureter. One is the vertical part of the pelvic part and one is oblique part. This is the first part and this is the second part. Okay. This is the obliquity. Initially, this is the abdominal part and whenever it has reached the pelvic brim over here, that will become the pelvic part over here. That too in front of the common iliac arteries division over here. So from that part, it will be running over the pelvic surface of the, what is it, ilium bone till the ischial spine over here. So this part is vertically going downwards over here. Getting it out? Vertically going downwards. Could you able to imagine or not? Could you able to imagine or not? No? No? Yes sir? Or shall I get the pelvis? Shall I get the pelvis or could you able to remember? Help me? No? Okay, let me get it. So how to keep it in analytical position? In this manner, right?
No.
Right?
No.
Like this you have to do. Very good. Fine. Alright, good question. Thank you. Okay. Okay. So this part is the abdomen, and this part is the false pelvis, and this part is the true pelvis. False pelvis, why? Because what is the word? Not covered by the entirely by the bones. Is it or not? But the true pelvis will be covered in all the sides by means of the bones over here. Okay. Okay, that's the difference. Okay. So the ureter, the abdominal part of the ureter will be emerging out all the way from the kidneys and goes straight away downwards, and little bit goes laterally over here and reaches this sacroiliac joint over here. Could you able to understand? Right? So at this sacroiliac joint is nothing but the pelvic brim over here. Could you able to see that? This is the pelvic brim. You know the points, right? Linea terminalis and everything. Could you able to remember? On either side the linea terminalis, if you join together, that will form the pelvic brim. Okay. So the ureter will be running downwards and laterally. The abdominal part will be running downwards and laterally, and will be reaching the sacroiliac joint at the level of the pelvic brim over here. Here it is related to the bifurcation of the common iliac artery into external internal iliac artery. Okay. So further, this part will be going vertically in this manner. Now we are entering into the pelvic part of the ureter. So far is the abdominal part. Now it is the pelvic part. So the pelvic part, the vertical part will be lying just parallel to the pelvic surface in this manner. Could you able to see that? Till the ischial spine, all the way from the pelvic brim over here, right from my index finger till the ischial spine. This is a vertical alignment of the pelvic part of the ureter. Could you able to see that? Could you able to see that or not in this manner? In this manner, could you able to see that? Could you able to see that? So it will be lying over the lateral pelvic wall over here. This is the anterior, here is the posterior. These are the two lateral pelvic walls over here. Okay. So all the way from in front of the greater sciatic notch over the pelvic surface of the iliac bone till the ischial spine over here in this manner is the vertical part of the ureter in this manner. Could you understand? Could you understand or not? Right? So from here, from the ischial spine onwards, it will turn obliquely in this manner because urinary bladder is in front over here. Getting it or not? All the way from the ischial spine, it will be turning obliquely downwards and medial. Got it or not? It will turn obliquely downwards and medial in this manner. So it is vertical above and oblique from below onwards over here. Understood or not? Could you able to imagine or not? Right? So this is that part of obliquity, oblique part of the, what is it? Pelvic part of the ureter, nothing but the second part of the pelvic part of the ureter. Third part is nothing but intravesical. Okay, for example, this is the urinary bladder over here. This is the urinary bladder. Whatever the ureter entering through the wall of the urinary bladder and opens by means of urethral orifices within the urinary bladder. This part is called the intravesical part. Vesicle means urinary bladder. Getting it or not? Inferior vesical arteries, superior vesical arteries, middle vesicle, whatever it might be. So those vesicle means urinary bladder over here. Okay. So the ureters will be coming on either sides in this manner. What's the length of the ureter in area? 25 centimeters, which is equivalent to one more other length. What is that? The ureter is esophagus, exactly. So the esophagus is around 25 centimeters and ureters are also 25 centimeters. These things they will last. Okay. So this is the abdominal part and now we have whatever.
So many things are there with 25
What? Many things are there. I told one of the aspects there. I am telling that they will be comparing the lengths of the different structures. Okay, just like that. Okay. So the pelvic part is the vertical part and the oblique part. The oblique part will be going downwards and medially towards the urinary bladder over here. Getting it over? And the third part is the intravesical part. Whenever it is passing through the musculature of the urinary bladder and pierces the mucosa of the urinary bladder on the inner aspect and will be opening into the cavity of the urinary bladder by means of urethral orifices over here. Getting it over? So this part is the intravesical part. It is also termed as intramural part according to the standard books. Okay. So it is termed as the intravesical part or intramural part. Intramural means within the musculature. Mural means musculature. Intramural or intravesical. Vesicle means within the urinary bladder, or mural means within the musculature of the wall of the urinary bladder. Got it or not? So this is the, so from here to here is the pelvic part, this is the vertical part, first part, and oblique part is the second part, and intravesical part is the third part of the pelvic part of the ureter over here. Now let us see the relations of it. So by this you can understand it is covered by the peritoneum over here, and then further it will be covered by the peritoneum over here. Is it not right? So, and these organs, urinary bladder or uterus and rectum and everything are subperitoneal. So everywhere the ureter is covered by the peritoneum from the front and on the sides also. That is one relation. But you will understand about it, right? Then the peritoneum is attaching over here in the lateral pelvic wall also. So this is, the ureter is plastered over the peritoneum over here, behind the peritoneum. Could you understand, right? So even the peritoneum also supplies the ureter. So if you suddenly remove the peritoneum in any surgery, so the ureter will be lacking the blood supply, and that part will undergo ischemia and necrosis. So peritoneal relation to the, with respect to the ureter is very much important. Getting it out? So if you remove the peritoneum, the blood supply from the peritoneum to the ureter will be removed, and that part of the ureter will undergo ischemia and necrosis. So that is the important relation of the peritoneum with that of the ureter over here. Getting it out? Right? So what are the relations of this oblique part of the ureter over here? Okay. In case of males and females together, so what might be the structures which are related laterally over? First of all, we will take the first part of the ureter over here. First part of the pelvic part of the ureter, what structures might be related over here? What? Iliacus, okay, fine. Iliacus is over here, psoas major will be going over here, that's okay. Any other? Internal iliac artery branches, exactly. External iliac artery will be going in front over here to the thigh, but the internal iliac artery will be going over here and again divides into anterior and posterior divisions, and whatever the branches which are given till this part, till the ischial spine part, will be the relations of the first part of the pelvic part of the ureter over here. What might be the branches over here? Inferior vesical artery, uterine artery, vaginal artery, and obliterated umbilical artery. All these will be arising from the internal iliac artery and will be going further upwards towards the organs over here. Is it not? Could you imagine it or not? Right? So urinary bladder, uterus, rectum over here. So inferior vesical artery, uterine artery, vaginal artery, and middle rectal artery will be the branches from the internal iliac artery which are in relation with the first part of the pelvic part of the ureter. Got it or not? Right? Right. So everywhere it is covered with the peritoneum, and laterally it is related to the internal iliac artery branches. What might be the lower relations over here? Lower, below the first part, what might be the relations over here? So this is the first part over here. This is the first part over here. Floor of the pelvis is over or not? Levator, ana and everything? Not yet over.
Yes, sir.
The pelvic floor muscles over or not? Not yet. So one of the pelvic floor muscles is nothing but the levator ana. You could even remember the levator ana muscle, original insertion, right? So that levator ana, nothing but the pelvic floor muscle, will be the lower relation of these ureter over here. Could you understand? So below the ureter there will be levator ana and its fascia, covering fascia over here. Okay, towards the lower aspect. Okay. So these are the relations for the first part of the pelvic part of the ureter over here. And now it is turning towards the pelvic cavity. Okay, of course it has entered into the pelvic cavity, but it is absolutely going into the pelvic cavity towards the urinary bladder over here. So what might be the relations of the second part of the ureter over here? What is it? What is it? Vast difference, absolutely. In case of males, if you take, there will be vast difference that will be going all the way from testis and will be going above the ureter and enters into the seminal vesicle over here. What is it? Vast difference. Okay. In case of males, whenever it is entering into the urinary bladder, this part of the ureter will be related above by means of vast difference, nothing but the male structure over here. That will be reaching the seminal vesicle over here. Getting it or not? In case of females, how it is related over here? Because there will be uterus over here. Because there will be uterus over here. The uterine artery will be going. Uterine artery is a branch of. Uterine artery is a branch of. So, okay. Study. What it is? So, what it is? Okay. Okay. Uterine artery. So, uterine artery will be going above the second part of the pelvic part of the ureter over here. Okay. So, in case of males, there will be vas deferens, which is running all the way from what is that? Above the ureter over here. And in case of females, there will be uterine artery which will be going above over here. Getting it or not? So in case of males, vas deferens. In case of females, uterine artery will be going above and of course on either sides also. So this is the relation of the second part of the ureter over here. Okay, clear or not, everybody? And what might be the medial relations over here in case of males and females? Medial relations over here. So these are the lateral and above relations. What might be the structures which are present over here? Medial, in case of females especially. Exactly. The vagina and supravaginal part of the, what's that right? Extravaginal part of the cervix over here. Extravaginal part of the cervix, nothing but the part of the uterus, and of course further downwards will be lateral fornix of the vagina. Will be the relations of the medial aspect of the second part of the ureter over here. Getting it or not? Simply to say that this is related above by means of vas deferens and uterine artery in case of males and females. And in medial aspect, in males, no uterus is present over here. But in females, there will be uterus. So below the uterus, there will be vagina and cervix. Those will be in relation with the second part of the ureter over here. Understood or not? Simply medial to the ureter, there is nothing but the cervix and vagina. Those will be the relations of the, nothing but the medial aspect of the second part of the pelvic part of the ureter. Got it or not, everybody? Getting it or not, right? And then below to that will be, below the second part of the ureter here will be seminal vesicles in case of females, right? Males. Okay. So below the ureter, because behind the urinary bladder there will be seminal vesicles. So below the second part of the ureter there will be seminal vesicles over here in case of males over here. Getting it or not? Right? So the intravesical part of the ureter is again oblique and directed medially within the wall of the urinary bladder. Getting it or not? Within the wall of the urinary bladder, this is the third part, nothing but the intravesical part of the ureter over here. Okay. So why this obliquity is needed in case of ureter? Exactly. Urine should not be reflux back into the ureter. So why there should not be any reflux? Reflux means reflux. It's not reflex, it's reflux. Reflux means back entry of the urine all the way from urinary bladder into the ureter. Why this should not occur? Why not? Why urine should be flowing all the way from the ureter into the urinary bladder? Why not from the urinary bladder into the ureter? Both are doing the same thing. No, one is carrying and one is acting like a reservoir over here.
So it can be hydronephrosis.
Exactly, hydronephrosis. So whenever the urine is entering over here, for example, there is a prostatic enlargement in case of males. In case of males, there is a prostatic enlargement which can commonly occur in case of males. Okay, prostatic hypertrophy. Okay, benign prostatic hypertrophy. Okay, in case of males, that leads to obstruction of the prostatic part of the urethra. Whenever there is an obstruction to the prostatic part of the urethra over here, there will be accumulation of the urine within the urinary bladder. That urine may reflux into the ureters over here. So the pressure over here will be getting backed up over here and that leads to hydronephrosis. What is the result of hydronephrosis? What is the result of hydronephrosis? When the pressure is backing up towards the kidneys, minor calces will be becoming convex, and if it is becoming convex, the pressure further will be applied into the kidneys and there will be pressure or crushing of the kidney over here occurs. That leads to the damage of the substance of the kidney over here. Getting it or not? So that is the ultimate effect of the hydronephrosis over here. Got it or not? So the reflex or what is it? Backflow of the urine from the urinary bladder into the ureter should not occur because that leads to hydronephrosis over here. Getting it or not? Because of the obstruction in the urethra over here. or the obstruction can be occurring within the urinary bladder because of the malignancy of the urinary bladder towards the urethral opening over here. Getting it out, right? Any malignancy of the prostate or malignancy of the uterus also may be compressing over the urethra over here. That leads to hydronephrosis because of this backup pressure and backflow of the urine. Could you understand it? Right? Right. So there are three constrictions in the ureter which are not anatomical but embryological. Okay. Where are the three constrictions which are present? The first constriction at the level of pelvic ureteric junction over here, and the second constriction at the level of pelvic brim, and third constriction at the level of entry point of the intravesical part of the ureter. These three constrictions you are supposed to know. Where are the three constrictions? One is at the level of the pelvic ureteric junction over here, and the other constriction is at the level of pelvic brim over here, and the third constriction at the level of at the beginning point of entry of the intravesical part of the ureter over here. So why we are supposed to know these constrictions? Actually, developmentally, the ureter will be developed in this manner, like a diverticulum. It will be developed in this manner. So these are the three constrictions. Getting it out? The diverticulum, two dilatation sort of diverticulum will be present embryologically. So because of these narrowing points, the ureter is constricted at this level. So why we are supposed to know these constrictions?
These diverticulums are not present.
What?
These diverticulums are not present in later stages.
Yeah.
So these constrictions depict the problems.
Yeah, what are the problems? That's what I'm asking. What problems you can expect if there are constrictions over here within the ureter? What is catheterization? Catheterization is okay, that's the second thing. It's a medical procedure. Okay, that's the difference. What is it? What it is actually? What do you want to say? See here. Whenever there are constrictions which are occurring within the ureter at these three levels, if there is a stone formation within the ureter, what is that? Ureteric calculus. Okay, ureteric calculus, nothing but the stone formation within the ureter. Okay, calculus. Okay. So because of these constrictions, there is a chance of obstruction to the stone passage through the ureter at these three constrictions. Could you understand? For example, because of the less water intake, okay, there will be formation of the ureteric stones, which are called the ureteric calculi. Okay, those calculi will be formed in the ureter that must be evacuated outside through the ureter and further urinary bladder and through the urethra outside. But because of these constrictions, they will be blocked over here at the level of the junction between at the level of the ureteric junction, or at the level of this sacroiliac joint over here, or at the level of intravesical part over here. Okay, so the narrowest part will be at the level of the intravesical part, beginning part of the intravesical part. So whenever there is a stone which is present in the ureter, that will be locked, especially at the level of this point over here. Getting it over? So because of these constrictions, the stone will not be evacuated outside that easily. So that needs surgery. It depends on the size of the calculus over here. If it is 3 to 5 millimeters of calculus, it will be evacuated outside easily. If it is beyond 8 millimeters, it must be operated and taken out. Okay, the ureteric calculus. And one more thing, whenever there is a calculus formation within the ureter, the patient will be having immense pain. Why it is so? So for example, if there is a ureteric calculus over here, do you think that hydronephrosis occurs over here or not? No? Why?
Yes.
Obviously yes. Because there is an obstructed calculus over here or obstructed calculus over here or over here. So whatever the urine which is draining over here will get collected at this part, and that leads to hydronephrosis. So ureteric calculus is also one more entity for the hydronephrosis over here. Okay. Then where was it? What I was saying? Yeah, why the patient has pain? Why the patient has pain, will be having pain because of the presence of the ureteric calculus over here. What might be the reason? Sympathetic. Sympathetic, it's okay, the pain will be carried. Why the pain is produced over here? Irritation, okay, to some extent. Any other? Any other? In case of intestines, or in case of ureters over here, both will be having smooth muscles.
Colicky pain.
What is it?
Colicky pain.
Colicky pain. What is meant by colicky pain and why it happens?
Smooth muscle contraction.
Exactly. Smooth muscle contraction. Remember always, in case of intestines, two pains occurs. Okay. One because of the persistent contraction of the smooth muscles, or because of the excessive dilatation of the intestine. Could you understand? Excessive dilatation of the intestine because of the stretch of the walls of the intestine because of any intestinal obstruction, or because of the stretch of the ureter because of the obstruction, that leads to pain. It will be carried by sympathetic nervous system. Okay. And one more thing, because of the persistent, constant contraction of the smooth muscles. Why there must be constant contraction of the smooth muscles in case of intestinal obstruction or ureteric obstruction?
Foreign body का बात.
Exactly. So this is like not like a foreign body, it is a foreign body over here. Normally it is not present. Okay. So either intestinal obstruction or the ureteric obstruction, the obstruction must be evacuated outside, either through the anus or through the urinary bladder and urethra outside. So in that mechanism, in that sequence, so the muscles will be persistently contraction over here. Because of the persistent muscular contraction, there will be pain. So two entities over here, one because of the dilatation and one because of the persistent or constant contraction of the smooth muscles on the ureter or the intestines, that leads to the pain. So because of the muscular pain, that is the smooth muscles over here, that pain is called colicky pain. Colicky pain. Getting it over? Colicky pain. So this pain will be radiated. The hydronephrosis. Why the hydronephrosis might be giving rise to pain in case of kidneys over here? In case of hydronephrosis, there will be pain, gnawing pain within the renal angle. Okay. Why there must be pain in case of hydronephrosis all the way from the kidney? Think properly. So which are the structures which are present in the kidney through which the sympathetic nervous system will be carrying the nerves, pain sensation. So two sorts of pain, one is because of the persistent contraction of the muscles and one is because of the dilatation or distension. What is happening in case, what might happen in case of hydronephrosis over here? Distension of renal substance, isn't that what? Distension of the renal substance because everything is obstructed over here. So the minor calyces are becoming convex and again that the backup pressure will be enlarging or distending the substance of the kidney. But the kidney is surrounded by a capsule. Is it or not? True capsule. So the true capsule will be carrying the nerves or not? True capsule or adipose tissue or false capsule, everything is made up of connective tissue. Connective tissue means it will be carrying the nerves towards the kidneys also. Okay. So whenever there is a stretch of the kidney substance over here, for example, the capsule is present over here around the kidney. Whenever the substance of the kidney is distended over here, abnormally distended, that will lead to stretch of the capsule over here. So whenever there is a stretch of the capsule, the nerves which are being carried over here will be irritated. So that irritation leads to the pain in case of hydronephrosis. Getting it out? Right? So in case of ureter, because of the persistent contraction or because of the dilatation, abnormal dilatation over here. But there is no capsule for the ureter over here. But in case of kidney, there is a closed space over here because of this true capsule. So that the closed space will be occupied by the entire substance of the kidney because of the hydronephrosis over here. That leads to stretch of the capsule. That irritates the nerves over here. That leads to the pain in case of hydronephrosis over here. Get it on? For example, so this calculus has been lost later on through the passage of the urine over here. For example, it is 3 millimeters or 4 millimeters of calculus over here. So whenever the calculus is leaving this part, there will be an inflammation over here or not. Whenever there is a calculus which is obstructed over here initially, but later on because of the musculature it has pushed outwards. But after it has evacuated outside, there must be little bit of inflammation left over here or not, right? Because of the calculus, because of the obstruction, there will be a rupture of the ureter wall over here. So because of the rupture of the ureter wall, there will be inflammation over here. That inflammation leads to fibrosis over here. That leads to narrowing of the ureter over here. Get it out? So the renal calculus has formed, that has evacuated outside, but left the inflammation over here. The part of the inflammation is a fibrosis over here. Because of the fibrosis, the urethral lumen will be narrowed at this point or at those 2 points over there. That leads to partial obstruction of the urinary flow. So even after the evacuation of this ureter calculus, the patient will still have the hydronephrosis because of this narrowing over here. Getting it or not? Because of the calculus, there will be obstruction leading to hydronephrosis. Even after evacuation of the calculus also, because of this inflammation over here, there will be narrowing of the lumen. Because of this narrowing of the lumen, again the hydronephrosis will be frequently occurring in the post-ureteric calculus patients. Understanding or not? Right? So because of the inflammation occurs. And what is the other reasons for the inflammation within the ureters? That leads to hydronephrosis. What else you can think? Apart from renal calculus, ureteric calculus. Sorry?
Accessory renal artery obstruction. Accessory renal artery obstruction.
What is it?
Accessory renal artery obstruction.
Accessory renal artery? It's okay. I'm asking about inflammatory. It's not mechanical obstruction. I'm asking inflammatory obstruction. Infection, absolutely. Whenever there is a chance of infection all the way from urinary towards the kidney, there is a chance of inflammation of the ureteric wall or not. Ureteric wall or not, right? Whenever the infection is ascending through the ureter into the kidney, there will be lodgement of the infection here and there. That leads to inflammation of the ureteric wall over here. That leads to again fibrosis. That leads to narrowing of the lumen. Again, that leads to hydronephrosis over here. Getting it or not? So whenever there is a narrowing of the lumen or complete obstruction of the lumen of the ureter, there will be backup pressure. That leads to hydronephrosis, and that hydronephrosis leads to stretching of the capsule over here. That leads to pain in the loin over here. Got it over? Okay. So the patient comes with the pain in the loin, and that is radiated towards the groin and anterior aspect of the thigh. Why there must be anterior aspect of the thigh pain radiating in case of renal and ureteric problems over here? So the kidneys and ureters will be carrying the pain from these two structures will be carried to which spinal segments all the way from T10 to L1. In certain books, T11 to L2. Okay, leave out. Okay, but most of them T10 to L1. What are the terms which are situated in the abdomen over here? T10 at the level of umbilicus. Below that will be T11, T12 and L1. L1. Okay. In front of the psoas major there is a nerve called genitofemoral nerve. What is the root value of it? What is the root value of genitofemoral nerve? L1 and L2. So part of the L1 is present over here. What is the nerve supply of the genitofemoral nerve? The genital part will be supplying the cremaster muscle, and the femoral part will be supplying the upper aspect of the thigh. Femoral nerve. Front of the thigh, right? Front of the thigh. Is it or not? Front of the thigh will be supplied by the femoral part of the genitofemoral nerve. Is it or not? Lateral femoral cutis of thigh is different. This is the femoral part. Okay. So the upper aspect of the thigh on the anterior aspect, and the groin and the flank over here and the loin. Everywhere it is supplied by means of T10 to L1 segments of the spinal cord. Is it or not? Is it or not? Right? So T10, T11, T12 and L1. Okay. All the way from back towards the front. Is it or not? All the ribs will be intercostal nerves will be coming in this manner. All the way from back to the front. Right? So the genitofemoral nerve will be giving rise to, supplies, motor supply for the cremaster muscle. So whenever there is a pain in the kidneys, or whenever there is a problem in the kidneys and the ureter, what will happen to the testis with respect to the genitofemoral nerve? So there is a pain because of the problem in the kidney and the ureter. There will be stimulation of the genitofemoral nerve over here. What will happen to the testis with respect to the cremaster muscle? Absolutely, the testis will be pulled upwards because of the action of the cremaster muscle. Getting it over? So whenever there is a problem in the kidneys or the ureters, there will be cremastric muscle, nerve supply by means of genitofemoral nerve, that will lift up the testis towards the superficial inguinal ring as just like a side effect over here. Getting it over? And the pain will be radiated all the way from back, from the renal angle, till the front, till the groin, and till the upper aspect of the anterior aspect of the thigh over here. Getting it over? So how this genitofemoral nerve is irritated over here? Whenever behind the ureter is the psoas major, is it not? So in front of the psoas major and behind the ureter is the genitofemoral nerve. Whenever there is persistent contraction of the ureter over here, that will be hitting behind the genitofemoral nerve over here. Getting it over? So because of the irritation of the genitofemoral nerve, that will be stimulating the cremaster muscle. The cremaster muscle will be contracted and the testis will be pulled upwards towards the superficial inguinal ring. Getting it over? Understanding or not? Why the cremaster reflex occurs over here? Because of the renal pain or ureteric pain over here. Because the persistent contraction of the ureteric muscles over here will be hitting on the genitofemoral behind it. So the genitofemoral will be irritated over here. That leads to the motor activity of the cremasteric muscle. That leads to upward pulling of the testis towards the superficial environment. Got it or not? So in case of renal pain, there will be pulling up of the testis of that particular side towards the superficial inguinal ring over here. Getting it or not? Right? Okay. So what is the blood supply of the ureter? You can easily say. What is the blood supply of the ureter? What are the vessels which are closed to it will be supplying the ureter over here? What is it? What is it? Gonadal artery and any other? Renal artery will be supplying, gonadal artery will be supplying, further below will be aorta will be supplying, common iliac artery will be supplying, internal iliac artery will be supplying. Whatever the vessels which are close to the ureters will be supplying the ureters over here. Renal artery, gonadal artery, aorta as such, and common iliac artery and internal iliac artery, and even vesical arteries and rectal arteries also will be supplying the ureter over here. Getting it over? How they are supplying? They will be supplying. If it is from renal artery, then we will divide into ascending and descending branch. Gonadal artery, ascending and descending branch. So all these vessels will be anastomosing with each other in this manner. Okay, getting it over? And will be supplying the entire ureter over here. And also by means of peritoneum, which is lying in front of the ureter, will also be supplying the ureter over here. Getting it over? Right? For example, if a patient is undergoing hysterectomy, hysterectomy means removal of the uterus. Removal of the uterus is nothing but hysterectomy. This first part of the ureter will be lying close to the ovary over here. Try to understand this properly. See this properly. This is the ovary and this is the uterus over here. The first part towards the medial aspect or towards the anterior aspect, there will be ovary. Getting it over? So if there is any malignancy of the ovary occurs over here, there will be obstruction of the ureter occurs at this level. That again leads to the hydronephrosis over here. Getting it over? So whenever you are supposed to remove this ovarian tumor, there will be ovarian artery going into the ovary, right? Ovarian artery, ovarian artery is a branch of iliac artery. Then what is gonadal artery?
Abdominal artery.
What is gonadal artery in case of females? Ovarian artery, yes. Uterine artery is a branch of internal iliac artery. Okay. So all the way from the aorta, there will be gonadal artery, nothing but the ovarian artery. So before removing the ovary, we are supposed to ligate the ovarian artery over here. Is it or not, right? Is it or not? So for the removal of the ovarian tumor, we are supposed to first of all ligate the artery supplying it. Otherwise, the bleeding will occur. So at this ligation, if the doctor, for example, by mistake, if he ligates along with the ureter, again the hydronephrosis will occur. Or while removing the ovary, if he accidentally injures the ureter over here, the urine will be leaked into the pelvic cavity over here. Do you understand or not? Right? So during hysterectomy also, whenever it is passing just adjacent to the uterus over here, during hysterectomy also, whenever he is trying to ligate the uterine artery, he may ligate the ureter also over here. Again, it is leading to the hydronephrosis over here. Or if he accidentally cuts this ureter over here, again the urine will be leaked into the pelvic cavity over here. Getting it or not? So chances of injury to the ureter are the same. Getting it or not? Right? So because of the malignancy of the ovary over here, there will be obstruction of the ureter leading to the hydronephrosis, or the doctor might accidentally ligate instead of the ovarian artery over here or along with the ovarian artery. And during hysterectomy also, if the doctor accidentally ligates the uterine artery along with the ureter over here, again hydronephrosis occurs. Or if he cuts over here, the urine will be leaked into the pelvic cavity over here. Or because of the malignancy of the uterus, this part of the ureter or second part of the ureter will be compressed, again leads to hydronephrosis. Getting it or not? Hydronephrosis occurs because of the ureter calculus over here, or because of the inflammation followed by the infection of ureter calculus, or because of the malignancies over here, or because of the ligation in case of hospital, by means of the doctor over here. Understanding or not? And then injury or the obstruction will be occurred because of the malignancies or because of the ureter calculus and everything over here. Understood or not, everybody? Right? So why I am discussing all these clinical aspects? You are supposed to understand. The patient is brought to the casualty, the female patient brought to the casualty with an, not casualty, in case of gynae OPD, with an with the mass in the abdomen over here, or towards the right side, for example. Okay. The patient is complaining about the pain in the loin that is radiating to the groin since so many days. What you will suspect? A swelling over the right side of the abdomen in case of female, not male, in case of female. So right side of the abdomen towards the lower abdominal, lower abdominal what is it, cavity over here. There is a swelling on the anterior aspect, okay, towards the right side, for example. And the patient even complaining of the pain in the loin radiating to the groin over here. What you will suspect? Correct? Hydronephrosis is one thing, and the other thing is ovarian tumor. Only one side it is enlarging over here. The swelling is present only one side over here. Getting it or? So that leads to swelling over the anterior aspect of the abdomen, and that further led to the hydronephrosis over here. Questions will be asked in this manner. They will not ask directly what is the ovarian artery supply and what is the uterine artery supply. They will not ask. Okay, right? Try to understand this properly. Okay. So if you couldn't able to identify a particular reason for anything, give the differential diagnosis. Differential diagnosis means one common features for the other diseases also. Okay. For example, epigastric pain. What you will suspect? Either gastric ulceration or the cardiac ischemia. You can suspect both of them. If you can't able to come to the conclusion, you write the different diagnosis what are possible over there. So you will get at least half of the marks. Got it down? Don't just leave and don't just ignore the question. Got it down? Right? Think and answer. Okay, got it down? Right. So today also same thing. If you want to see the viscera, you can see. If you don't want to see the viscera, it's okay. That's not a problem. Yesterday you have already seen the viscera. Kidneys and the ureters. Kidneys and the ureters. If you want to see, you can see. If you don't want to see, it's okay. That's not a problem. Yesterday you have seen already. Alright.